Good morning, everyone.
Hello.
Well, welcome to the Roads Monthly webinar. Sorry I missed you guys last month, but I had a very nice trip to my homeland and um, had a really good time and good weather for a change. And it's further north than here, so I was lucky. But it's great to be back and eager to go forward on the roads path because we are going into great times. We start by, of course, having our monthly webinar, and this month is focused on EDI, or as we call it internally, the Jody Kramer Show. And I think it's definitely going to be. She has a lot to talk about, and as you can see on the agenda, we're going to do a little welcome and we're going to review the agenda, meet the team, talk about the objectives. What do we do every month here on this webinar? Of course, everybody knows that by now who has anything to do with behavioral health data gathering that Rhodes is live and that the Rhodes EDI transition update will be coming from Jody. She's talking about file errors, policy of decertification, reports, data exports, and the Rhodes system use. And we're going to talk a little bit about some next steps. Always room for questions, and that is the nice thing about this Teams media, that you can just jump in, you can raise your hand, you can put something in the chat. There's so many different ways to kind of handle everything, and I really like that about these new tools. There's sometimes progress is not always improvement, but I think some of the tools that we are getting are helping us. And one of the tools that we are working with is Roads, and there are comments and questions about lots of things, but I think overall it's another step forward. So, but why don't we go and meet the team? For those of you who are new, you might not know everybody. And I'll start with the two system admins or data administrators, Kayla Camilli. She is the Rhodes system admin officially, and Jody, also part of the Rhodes team, our EDI technical expert. And then you'll see Lisa, who is our junior system admin. She is still kind of new, but she's picking up a lot of things. And we have a large team, and but also an application that needs a little more people to kind of being able to give everybody proper support and timely support. So that's why have been adding several people. So myself, for those of you who don't know me, Pete Vermeer, Senior Systems Analyst, been with this project for a while, been on other projects, and of course was with the whole MOTS, the Rhodes predecessor, for many, many years. So but still here and still enjoying it. So, and glad to see everybody still hanging around. Very important one, of course, Mary Hurley and Cecilia, support specialists, that kind of like the front desk of any questions that you might have or any issues, problems. You can always rely on Mary and Cecilia to kind of pick up on that. And if they can't help you right away, and they can do it, they're doing a very good job helping everybody. But then there's always they know who to send it to and try to figure out on how to get help. So Justin, Anna, report specialist and data analyst and research analyst. They're still working on little kinks here and there to be able to help you. They would like to help you in a certain way that would really be satisfying to everybody. We're still working with our developer of the road system to improve on that part. So, but the sooner we get better tools and the data backup system working better and working the way we would like it, then you'll see that the services provided by Justin and Anna will really jump a big step. So, and of course, Kelly, who made this wonderful webinar and is our communications expert. Okay, that is the team. What do we do? Well, we have a webinar and we do it once a month, every first Wednesday of the month at 9 o'clock. Has been doing that for the last 10 years. And I think everybody knows it and I like it. That at least there's some consistency. And what do we do? Well, any information, any changes, any new things coming up, any updates, any improvements, things that we're doing better or planning to do better, we will let you know today. We have other tools, of course. We have our messenger that we send out on a regular basis, but this webinar is here for everybody to kind of jump in and kind of get all the updates that we have. Another thing that we like to do is discuss data issues. Um, we know that with all the information coming in, we sometimes notice that there are certain trends of data not looking the way we think it is expected. We look at society, we know what's happening, and if we don't see that represented in our data, or we see different things represented in our data, then we can always use this medium to kind of discuss those issues that we found. Or if we found out that certain data is not there, then we might bring it to your attention, and you guys can talk it within your organization to say, hey, what's going on? Is there something? Are we missing something, or is there something not going right? And then we can use this here. So what we love to do is get your feedback. Any information you have, any questions, any suggestions. That also includes ideas for future webinar topics. You might think that, well, maybe we should focus on non-Medicaid services, because we kind of, it is a big part of the system nowadays, and how do they relate to other data, and what are they used for? How can we give the best information? You can give the best information to us, so we can provide that information to all our management and all our state representatives and everybody who needs information and works with this information to improve the health care that we have, and the behavioral health care and treatment that we have in Oregon. So any ideas for that will be gladly accepted, and hopefully we can do something with it. So, and of course, answer any of the questions that you might have. That is always the case. So, and even if you don't have a webinar to put questions on, we'll give you a little bit later some information on where to place them, and then hopefully we can answer them quickly. Okay, the next slide is Rhodes is live, the Resilience Outcomes Analysis and Data Submission System. That's the Rhodes system. And I always have to remind me of that, because it's kind of like a tricky one. The MOTS was Measures and Outcomes Tracking System. It's kind of like in my brain at the moment, but Rhodes will get there, but it probably takes a little while. Officially launched on March 11, 2025, and Measures and Outcomes Tracking System, the MOTS system, has officially been put on hold, and the data is all there, and it's copied over in that all the live data is copied over into Rhodes, and the historical data is placed in historical servers and environments where we can get to it in case anybody needs it. So, but we are live, and the version 1 is up and running, and basically what it is a copy of what MOTS was, and that was our goal. And we are working, and there's a little kinks here and there that we're trying to work out, but we seem to be getting there. So, excuse me. I think it's time to hand over the microphone to Jody, because my voice is kind of going a little bit. Go ahead, Jody. Start the Jody show.
All righty. Awesome. Awesome. Welcome, everyone. Thank you all for being here. There's lots of you here. So, super excited to see all your names and stuff. So, yeah, the EDI roads transition, finalizing our version 2 standards. I know that has been a top of mind for us for, oh boy, at least a couple of years or better. So, wanted to say the data dictionary for version 2 has been finalized and will now serve as the baseline reference for all EDI V2 submissions. Now, its companion document, which is the V2 file specifications guide, is currently under review. It is, I'm going to say, probably about 95% complete. Pete, myself, and another couple individuals on our team are currently going through that in collaboration with our technical folks. So our goal is to get the completed approval during May of 2025. I always like to throw the year in because I've given dates and times that we had to kind of kick the goalpost further. So, and again, this will be the official structure for all, production submissions going forward for V2. At some point in 2026, EDI V1 will sunset. So currently you're all using V1, keep doing that. That's perfect. And when these two documents come out, I know that your EHRs, for the most part, We've been in contact with the bulk of the EHRs housing the majority of you. And so they are aware that we are at kind of this timeline. And for those of you that have attended individual EHR partner Roads Connects, thank you for being there for those. So we may get authorization to pop the data dictionary out ahead of the file specs. And I know that that decision will be here within the next couple weeks. And if we get that, which we're hoping to, then we'll be able to get at least that out the door. You'll be able to see the new fields, the values, stuff like that, and the order that they're kind of in. And then the other document will be the exact format for the file itself. So, anyways, exciting news there. It's becoming a reality. So, yeah, more to come, but we're getting super close to the finish line here. Can you uh, push to the next one? Okay, so we have a few things we wanted to cover now that Rhodes is live. We have we the road staff now have a lot of ability to monitor stuff, to see things, and for EDI we got a lot more visibility. So for file errors that come in, since we can now see a lot more almost in real time, all data is being monitored nightly, and we're actively flagging persistent error patterns. Okay, so we have been reaching out to those. Mary Hurley, Pete, and myself were able to see these files. We're able to see how many passed, what didn't, your errors, like a lot of things. And so, for those that are having a high pattern of errors or non-success, we have been reaching out to those individuals and organizations, the actual provider, to work together to figure out what's happening. Okay, because we are, everybody's expected to track and resolve your issues slash errors, and keep everything in good standing. That just helps maintain the consistency of your data being accepted by roads and processed. Now, we wanted to remind folks, we haven't talked about this for a long, long time, but there is the ability that we have to decertify you as a provider. And what that means is if you have ongoing or egregious submission errors, it may result in a temporary decertification. And some examples of this would include, submitting files without resolving known errors that are causing the majority of your transactions to fail. Like if you're sending in a file and you have, a 70% to 95% failure rate consistently, file after file, that becomes an issue and something that we want to collaborate with you, of course. But we want to make sure that the data quality, like that is our primary concern. If you're submitting incomplete or invalid data that compromises the system integrity, we could also decertify you. And this includes version 1, so like what you're currently doing. Um, if you or your EHR are making changes to your structure of your file or your things like that, it would be best to give us a heads up. And, there's ways that we can have you just send those as a cert file so you don't actually disrupt any of your live data. We just want to make sure that everything is going as planned. And sometimes some of you may or may not even realize that this is happening. So we just wanted to remind you of this. Reports and data exports. The reporting functionality is not fully operational to get the reports fully distributed to everybody. We're targeting the date of June or sooner, and we'll definitely notify providers when this becomes available. What Justin King and Pete and us are working really hard on this. The reports are available. It's just that last distribution piece. So if you need something that is immediate, then please reach out to Road Support, aka used to be known as MOT Support. Um, and we have a few things that we can do to provide you some information as one-offs, which we have done. And so, anyways, there's more to come on that, but we realize that this is a barrier, and we have been escalating this with our management and leadership. All right, it looks like, are you all being able to catch the chat okay, Pete and whoever?
Yes.
Okay, all right, super. So,
Yeah, we'll keep an eye on it.
okay,
Sorry.
perfect. I figured you were. I just was like, I didn't know if I needed to pause and
No, not
elaborate.
yet. If
So,
if there's something that might pertain to everybody, then we'll I usually bring it into the chat. So
okay, super,
yep.
super. Okay. So,
Go ahead.
all right. So, as we went live with all systems, we found some issues. Thanks to all of you who are reporting diligently and working your error reports and going, what is happening right now? So, thank you all for those who have been collaborating with us and letting us know what's going on. If you see something odd that you didn't see before, please, definitely shout out to us because it may not be your deal. So, we're going to highlight a few of those things. So, batch number already used, insert files. And this isn't as much a huge error, but we wanted to let folks know that if a file is tested using the cert prefix, and what that means is if you're sending a file that you just want it checked, we have this appended CRT, CERT, that goes in the front of your file name. When you put in a cert file, it consumes a batch number. So if that same batch number is submitted again, like as a real file or even as another cert file, it's going to fail. So what we recommend you do is update when you're resubmitting, okay, or you're pulling the cert off, update the file name and the batch number before the real submission. Yeah. So we've seen some folks having some barriers with that. And part of this came more to light of a barrier because our online sort of little file checker tool is that we had in Mott's is not quite available yet in Rhodes. And so folks have been, there's only a few of you that use this, but we just realized that we wanted to let folks know this again, because if you are moving to different EHRs or you're in the process of becoming certified, that this will consume your batch number. The batch number, I see somebody asked, how is the batch number updated? So it kind of depends on your EHR and how your files are created. Um, each one has kind of a different way that they do that. Um, Typically, when you create a new batch, depending on your EHR, it will increment and give it a new batch number. Um, some of them create a weekly file, and that one, if you were trying to resubmit it manually, you might have to go in and actually adjust that in the file itself, which is something that some of y'all do. And so there's many different ways. If you, the person who popped that in the chat, if you want to, send us a email, like we can talk about which EHR you have and kind of figure out how or this may impact you and what you might need to do. So secondly, we have some first name update errors that are happening. We've got kind of two types. So for those of you that are looking at your results files, or the information coming back into your EHR that have like automated results and errors coming in, um, the first name, when you're updating it, is sometimes causing errors. And what the error, there's two different ones you might get. One is the client already exists, and this happens when trying to update the first name of an existing client in the same facility. We have logged this as a known issue, and we do have a fix in progress. It will probably be coming out midsummer. The We've got a couple minor releases that are happening here over the next few weeks, but the one that this will be included in is looking like the midsummer release. So the second error you might get when this is going on is the check client overlay. And again, this is triggered when the system detects a mismatch in the client identity. And because of the way that this is kind of doing things, even if the last name at birth and the date of birth are the same, which normally would have just sent the thing through, you have a different first name, it will then pop this error. So again, this one is also being addressed. It will be midsummer. In the meantime, as you're getting these errors, please contact road support. Um, Mary has been working feverishly on helping you all with doing some of these first name updates and other things to kind of work around this issue. Um, I see Esmeralda has her hand up. Would we like to?
I have another question before we go there from
Sure.
Lydia about the cert files. They go through SFTP, but is there in the future an idea of creating a portal, a testing portal, where you drop your
Yes.
files and see what they do? We are working on that. Good.
Yes. Yeah, Lydia, we definitely have that on the books. It was one of the features. We went live with what they call an MVP. We love acronyms, right, in IT. So it stood for minimum viable product, not most valuable player. So anyhow, with that being said, we triaged and prioritized some of those things, and that one didn't. I didn't quite win my campaign, but it is coming. Hopefully, I don't know if it'll be fall, but it will be on the docket here soon. And when we have another one of these updates, it will definitely be one of the things that we share information on. Okay, Pete, did that help?
Now, yes, definitely. Now, Esmeralda, go ahead. She has her hand up.
Okay. Good morning. So
Hi.
my question is, so I've been having some errors come back to me as the first name. So there are some clients that we have to update the name because the insurance changes them. Like, so I have a client, let's say that their name was put as first and middle name all together. And so we changed that in our system, and when I do the batching, it comes back to me as an error because of the name.
Right, and we have
How
to
do I
I have
update that?
you have to tell me, and I have to go in and fix it, so
Okay.
it will, um,
And
go
yeah,
through.
okay. I think I emailed you the ones that I had. There's a couple that I know that we've been emailing about, some with the middle initial of two,
Mhm,
but
right.
there's ones with like the name too. I will look at it and make sure that I emailed you then.
Okay.
All right, perfect. Thank y'all.
Yeah, sometimes I don't get, this is new to me, so sometimes when I make the correction, I realized, "Oh, I need to correct it here and over here." So, I may not get it if it's a new type of correction, I may not get it right the first time, so we'll just try again.
Okay, perfect. Thank y'all.
Yeah, and I would like like to give a shout out. Mary has been really helping tag team stuff with me and on the EDI side. And just yeah, it's the whole team is amazing. But for me and the EDI stuff, I've just been like, Mary, you are rocking it right now. So it's been great. Um, okay, do we want to go to the next one if we're good, Pete? Or
Yeah,
whoever
I think we're
the
good. Yep.
the trigger
We
finger
have
was.
to ask Kelly.
Okay, Kelly. So, okay, so the other thing, there's a couple more. So, the admission date already used message. Some of you may be getting this that weren't getting it before. Um, so this error you're getting it for two different reasons. So, when a provider, if you send a closure with the same admission date and the same closure reason, over and over again, you're going to get that the admission date has already been used. Because when you're sending it over and over again with the exact same information, there's nothing for roads to really accept or update, right? So when a new submission, okay, next thing, when a new submission with the same admission date comes in and is marked active when a client was already closed, you're also going to get this message. This message also comes with the date that was that you put in. Oh, there's more information than just that, but you'll get the actual admission date it's speaking to. So roads allows updates to closures if the closure reason is different. Okay, so if you're getting these errors, you kind of have to look and see, am I just sending the same admission date that I've already closed with the same reason? Because some of you may not realize that your system is sending the same old one over and over and not picking up the new one, right? Because sometimes people leave and come back. Now, it also helps you to know, if you are trying to reopen a priorly closed episode of care with an admission date, you can't reopen that once it's closed. So we recognize that MOTS was allowing the first bullet here in number 3, allowing those to come in over and over and over again with the same admit date and the same closure reason. But roads is not. It's allowing. It's not allowing that. So we recognize that having a single error message for kind of 2 scenarios is confusing. So we are going to be revising the error message to help give more information, so besides the admission date, like what is in the treatment status field. Like, were you trying to reopen it, or is your system just sending the same one over and over again? So in a way, it's good, because you know you may or may not have known that a current one is not getting reported or not getting picked up, right? And sometimes it's just due to a lot of different issues and things aligning in your system and your forms, or however it is your roads data is collected. Okay, so if you're confused on this when you see them, just reach out to us. We'll be able to help you figure this out. The next one is the service file adjustments. And not many of you do this, but some of you do. And what that means is when you send your service file in, you send individual transactions for your clients for different services that were provided to them. And it has a billed amount, procedure code, units, diagnosis, so on and so forth. And sometimes you might be like, oh, geez, we sent the wrong amount, we sent something. And so you put an adjustment flag in the field for this. And what we have not got in roads fully are the prior transaction slash submission IDs for the service files that you had sent in prior, before March 7th, that we're going into MOTS. So when you're asking for an adjustment, the road system is like, I can't find that number, right? So a fix is coming in May. We've got a data fix that will be pulling in all of those historical IDs for service files, that got, there was just so much data. We moved over 11 years of data. So, yeah, but that's coming. If any of you are getting that, I think this is probably a super small pocket of people. But anyways, we wanted to bring it to the larger group. Okay, do we want to pop on to the next one, or do we have are we, okay. All right. So we have some next
We have a couple of questions about
Okay.
some
Well, let's
about some
pause.
stuff.
Okay.
Let me see. There's some stuff going on about client IDs, but there's also about old clients, and maybe there's some confusion about it. If your client was active in MOTS, it should be active in roads, because we moved all active clients in MOTS into roads, because I thought I saw that question. If they were closed in MOTS and they're now new in roads, then you just enter them as a new client. But the dates should still be different and stuff, so they can't have that admission date. I hope that clears things up a little bit, so, because that's what I think the confusion was. If it wasn't, please let me know. Go ahead, Jody.
Yeah, and definitely, as Pete's saying, like, yeah, all the clients, everything that you had in MOTS that you'd submitted was brought over into roads. So these next steps. Oh, okay, Lisa. We have Lisa with a hand up.
Go ahead, Lisa.
Hi, thanks. Okay, so I'm still a little confused because I was under the impression that with clients who previously were closed out, but then were put back into the system, that the initial and the initial date was kind of necessary because if there were any old um, payments that still hadn't gone through, that we had to re-enter them as from the oldest point. So that's not applicable. We have to start like act like they're a new client when we're re-entering into roads.
No, I don't believe, if I'm understanding, the whatever the status was, if they were active in MOTS with an
I'm not
within a,
talking about, yeah, I'm just talking about if regardless if it was MOTS or roads, if they've been closed out and they've come back to the practice, how do we enter them back into roads to avoid that problem?
you would have to enter them in with a new admission date.
Okay, that was my question. All right, thank
Yep.
you so much.
Okay, sorry. I didn't catch what you were trying to say in the first
No, I
part.
think we were just kind of talking over one another's heads. So, thank you.
Yeah, no worries, no worries at all. So next steps that are going to be happening for all of you, we are going to be getting all of you individual user access and what we call a P number, which stands for partner number. We also call them UPNs now, if you see that when your stuff comes out. We are prepping up to get you all access to the roads portal, because the roads portal for you all as EDI users is very different than MOTS. MOTS was pretty much 98% unusable for meaningful things, right? For looking at client data or doing anything. So the roads portal, hearing that for the last 11 years, we brought stuff in to give you visibility into your submissions that have come in at the file level, your clients at a actual client level where you can drill into the client, you can search your clients, you can search by your facilities if you have more than one. We have some dashboards available as well. One looks like the active client monitoring report. So as we get you all in there, you're going to be able to have eyes on that, because hopefully we'll have the reports out in June, but if we should not, this will give you some visibility. Now, how this is going to start out is that our team, Mary Hurley and Lisa Seiko and a few others, will be reaching out to each agency. Now, I went through my list of all my EDI providers and I put the most recent contact people that I've been working with. So Mary and them will be working off from that list, and they will be reaching out and finding out whether you already have a user deal or not. Most of you won't. Um, and who needs that at your organization. So when this outreach happens, they're going to find out who needs to be in the roads portal. And remember, this is individuals logging into the portal. You each log in with your own user access and your own password. They will also be going through the steps to make sure that you request these, that they get created by our OIS teams, that all the things are in alignment in roads, and that you can get through your other steps for multi-factor authentication, because that will be an aspect of it. Okay, so big thing is just please respond to anything you see from road support, especially around this piece, because we want to ensure all of you have relevant access before July. Because in July, we will be doing, quote, formal training for roads, portal, and EDI processes. And we're hoping to get those dates out sometime around the first part of June ish so that you can start getting signed up. Okay. And we went with July because we know there's a lot of year end for those that do a July to June thing. And we felt like right after the 4th would be good. So people can kind of do their 4th vacays or whatever they're doing. So this training will include guided walkthroughs, best practices, yada yada, a lot of stuff. And we also have some videos that have been curated for you all to be able to watch as well. Now, what you may find out though, because Mary has been really stepping it up as people have been getting their users and their P numbers. Um, she has been getting them into the portal. So even though you won't have quote formal training, the portal is pretty intuitive. Mary is, I sat with her, she stepped folks through it. And so you'll probably be in the portal way before the training. So the training may be just like a formal refresher for you to know how to specifically do things. But it's very exciting because there's a lot of things you're going to be able to have access to and to see. And at your client level, all of the old submissions you did from into MOTS will be there too. So if you drill in and you look for Joe Schmo, right? And you're like, oh, wow, Joe Schmo has had, 6 episodes of care in the last 11 years and like, maybe a couple crisis events. So I think you'll all be excited. We had a few beta folks that have been in there and they seem to be, um, you know, they seem to be pretty excited, happy, and they're also giving us good quality feedback as well. So we have opportunities to make it even better. And of course, Mary will be supported by myself, Pete, Kelly, Lisa, Kayla. Like we got the whole team, but I just keep using Mary's name because she's been super, super there for me on this. So, okay, let's. Oh,
Lisa put the user request form out in the chat. So if you need access, want access, then please use that form.
yeah, yep,
That
definitely.
this
You can.
for all the treatment providers, not for EHR vendors, unfortunately. That maybe.
Oh, good call out, Pete.
Well, I got a question here from Gabriel.
Oh,
So yes.
yeah, yeah. Because for all of you that are going to get into there and access, like we have, all of our access agreements. Some of you may or may not be aware of them, but like at your agency level, we've got all these data sharing agreements. And so, yeah, it definitely is just limited to providers. So good question, whoever asked that. And of course, this access is for the portal. Your SFTP is going to remain agency specific. So, oh, is this my slide? All right.
Yes, it
Yeah.
is. Yep.
Oh, all right. Okay. Well, this is a new one for me,
It's a
but
Jody show.
well, I should worry about all your comfort. That's for darn sure because we want to make sure you're doing okay. So, how's everybody feeling? If you want to give a thumbs up, if you're feeling pretty good. Oh, look at all those little thumbs coming. And of course, you can drop questions in the chat. You can always reach out to us. I'm just excited you're all here. And honestly, the EDI V2, I'm kind of excited about us moving into it because I love the collab with all of you providers and your EHRs. And Pete and I will be tag teaming this so we make sure you're all supported. But I know, like, nerd alert, but I'm kind of excited about all of that. So,
Yes, and I
anyway,
already saw a big thumbs up from Kurt about how good the tool is to the roads portal working
oh,
for getting more information and everything. So yes,
yeah. Well, we've been hearing y'all. Pete and I've been paying attention for the last 11 years, and we're like, yeah,
yes, we
yeah,
have.
yeah. That Moth portal was a good start, right? But it just didn't get all the things we were hoping to. So we tried to get them in roads, and we'll
Right.
keep adding things too. So this is what's cool about the new platform is like as you all do provide us some, constructive feedback and stuff like that, we can, be like, okay, well that's like maybe something we want to consider. We can, get it logged. We can prioritize it. So, yeah, real excited about the new platform. Um, okay, question time. Yeah, you can all feel free to,
or thank you.
or thank you, or like, yeah.
Thank you in question. I thought there was another one about questions, but
I thought there was too, but this one threw
Well,
me, but I love the emojis.
here, we can do this
there
one.
you go. Hey,
Okay,
I,
Lisa, we have a hand up there, or at least one that I can see.
yes, Lisa, go ahead.
Hi, thanks again. I actually have a few questions that are just kind of general that I've picked up as I started using the system, if that's okay.
Sure.
Okay, the first one is whom do I contact if I have come across a file that has been misnamed using another client's client name?
The file itself with the file
Yes,
name, or the
I
client name?
I went to enter a client only to find out that they were entered under another client's username, under their client ID.
So you're having a duplicate client ID.
Right, there's a client ID that is for another OHP client, and for some reason, this other client has been entered under that person's username.
Okay, then that other user need to be updated. So you probably need to send a request to Mary to have
Okay,
that
Mary.
fixed. The roads help
Road
desk.
support,
Sorry.
yeah.
Oh, okay, so just go to the Roads Help Desk.
Yes, the support.
Okay.
Yep.
Okay. And then also, I was never formally walked through how to inactivate an active client. Is that something that, I mean, I've looked through the workbook and, you know, it just doesn't, give like a huge amount of information on that. Is it
Uh,
just something where you just put the last date in and it should be user friendly, or I just haven't had an opportunity to do that yet in the system, and I'm not feeling confident about doing it.
When you say inactivate, Lisa, do you mean deactivate or close the episode, or
A no
inactivate
longer
it?
active client.
No
Did
longer active
did
client,
they
but they
complete or leave, or it kind of depends on
If the client is no longer, if they've been
successfully
considered,
completed or
yeah, if they're no longer a client, if they've either stopped services or they've no longer come to
Mhm.
their appointments or whatever, what do we do in the road system to reflect that?
Lisa, can I ask a quick question? Are
Yes,
you entering your data directly in the roads portal for your clients, or are you sending files from your EHR?
I'm using the portal.
Okay, gotcha. Okay, that's okay. This makes more sense. Sorry, I just wanted to clarify. So, um,
I think we should give this question to our famous trainer, Kayla Camelli. Are you guys still doing the Wednesday trainings? Second Wednesday?
We do have our intro to roads training next Wednesday.
Okay, so would that be something I should go to then?
Yeah, if you think you want to get more practice in the train environment, and we'll go through how to accomplish some tasks in there, then absolutely.
Okay, yeah, as long as it's not the basic training, you know, like the very initial one, because I've already done that. I just feel like I need a little bit more in-depth help.
well, what I
Okay.
recommend, Lisa. Oh, go ahead, Kayla.
I was just going to say the training next week will be very similar to the one that we rolled out, the portal training that we've done the last month or so. But if you need help doing specific tasks like deactivating, like discharging a client, we do have YouTube videos that will walk you through how to do that. And we can put the
Okay.
link
Is
to
there any way
our
that I could
training
get
videos in. Yeah, absolutely. I'll put it in the chat.
fantastic. Thank you.
And
Kayla, are those the same ones that we used to have for mods? I wasn't sure that they were completed yet, so.
We do have new ones for roads.
Oh, excellent. For all of them?
I
Almost.
think we're working on, yeah, there's some in there, but we're adding to that as we go. So
Excellent.
we'll round it out here, hopefully within the next couple months.
Great.
Yep. And the only other thing I'd
Oh,
like
there
to
they
add,
are.
it's just real quick, is for all so just for clarification, it sounds like Lisa actually enters data through the roads portal through what we call like manual entry. Like Lisa's actually keying it in. For those of you that are sending files, you won't necessarily be, if you watch those videos, that's great to get an idea of like how the system looks and stuff like that. But most of you for EDI are going to have read-only access because we want the activities that, you know, your clothes and your episodes of care and stuff like that all coming through your file. So there'll be more to come on that to shake out the clarity. But just know as you watch the videos, it'll give you a great insight to the system. But it's definitely, some of them are portal entry specific. We do have some EDI ones that are either out there or coming soon. So anyways.
I
Thank
think
you, Jody. Jessica,
Yep.
yep. Sorry.
Hi. So
Hi.
I'm going to do both. Thank you, because yes, I agree. The roads portal is much more robust than the data that we had access to in MOTS. So that is great. I am a victim of some of the new error codes, though, that are slowing me down. So at this point, Mary, if I copy you on I mean, I think I sent them to road support anyway, but can I check in with you via email? Because I haven't batched now for 2 weeks because I'm afraid of compound errors at this point. Can I check in with you directly to see if the ones that I've already submitted have been fixed before I send in another batch tomorrow?
Yeah, you could. I have to see where those batches are. I know. So
this is emergence.
Yeah, the merge thing. Yeah, we don't have any way to do merges right now.
No,
so.
I'm
No, it's
representing emergence.
Emergence is the name
Oh,
of the facility.
emergence. I'm
Yeah.
sorry. I guess I need to clean some wax out of my ears.
No, sorry. Yeah, no, I'm representing emergence, and the two biggest errors that I keep getting are that first name. There's a difference in the spelling in the
Right.
first name.
I have to go in and I have to manually change those. So if you
Okay, and
I
the
know
other ones are I've shown you that the termination file for a specific admit date was accepted by the system with no errors. Yet when I submit a new admission with a new date, I'm getting the error that says this client is already open with the old admit date.
right. Jessica, are you able to log into Rhodes?
Yes.
Okay. So there is a way to, you can see the error messages on the files that you submitted, but you can also go to the client and see what's there currently. So you can compare the two, like Jody said, if there's no changes in that termination that was sent in, you can check and see
This
if,
is a new admit date.
a new admit date.
Right. So, I mean, I've outlined all of this in the emails, but I haven't heard back. And that's the thing. I'm not going to keep sending submissions if these errors haven't been fixed, because I'm going to end up with compound errors.
Right. Jessica, why don't we schedule a meeting between you and me and Jody, and we'll go over that. So
great.
Yeah. Yeah. And we might loop Pete into it too, because
Sure.
we've been getting a lot of these. This is causing a lot of, not just, it's not your issue, Jessica, but like in general with roads doing what it's either doing or not doing, it's creating some issues. So if we get Pete in the fold here too, then we can make sure that we've got you covered, because I know I still owe you some stuff.
Great. Yeah, I'm just concerned about backing the data, like having a backup of data that I submit that ends up with 3 or 4 more errors for each of the same clients where the first ones weren't resolved.
Yeah.
And as you know, our clients are in and out. So this is, it'll compound quickly.
Yeah, no, and
Okay.
I understand, and also with the way that your system is batching and submitting, like, yeah, I get what you're talking about. That sequencing and compounding it happens quick.
Yes.
So
Okay,
yeah,
great. Then yes,
okay,
if we can set something up, that'll be perfect. Thank you very much.
yeah, we will for sure. And if any of you others of you are having any like stuff that you want to just connect with us, I know we love emails and we love virtualness and chatting and whatevering, but sometimes if you feel like, hey, just a half hour connect might be quicker, always feel free to reach out and ask and see what we may be able to do. Okie dokie.
Excellent. Yes. Great.
Yeah. And by the way, everybody, we got Pete back and Justin fully assigned to our team. They
Why
had
does that
been
sound ominous, Jody?
well, I just
We got
because
Pete back. Ooh.
I'm excited. Like it's like we put on an old pair of sneaks that feel wonderful. So yeah, so Pete and Justin are back on our roads project, our system now fully, and yeah, it is very exciting because you all of us bring something to the table for the collective. So we're glad you're back.
Thank you, Jody. Very kind. Okay, and the final slide is there you go. Let's stay in touch. Questions, comments. Rhodes email is roads@odhsoha@oregon.gov. Or Jody, of course, because this was the Jody show. And if you need anybody else, like my person or Justin, or you have questions about data or reports or anything, start with the Rhodes help desk, the top one, and Mary, Cecilia, Kayla, and several people. Lisa is also watching it, I think. Several people are watching it on a regular basis, and they're pretty good at making sure that whatever you're looking for gets to the right person, and hopefully, and a very good suggestion that Mary did was, and especially in the beginning of a new season, a new system, it's nice to have a half hour here or a half hour there. That the team seems to be working very good with a lot of interactive connections. So it's always nice to just actually see it on the screen, talk it through. And I know we're all super busy, especially with all the changes and all the developments that are going on. But half hour here, half hour there, sometimes can do a lot more than 17 emails back and forth and back and forth. So
I chuckle
that's that's
because
that's
yes,
that
so
is
true.
my experience. So yeah, it's sometimes hard to get that half hour in here or there, but it can help a lot more sometimes. So cool, excellent. Well, thank you all very much. It was a wonderful webinar, and let's do it again next month.
Thank you.
Thank you, and have a
Okay.
wonderful rest of your day.
Thanks all.
Thanks, everyone.
See you guys.